children in Oklahoma. The federal match to state money is 75-25. What strategies do you have to acquire more federal dollars for our children's health, and can you help save our Medicaid system?
I think that's my question first, isn't it?
Well, first of all, having more physicians that will see Medicaid patients is really important to me, and I know the reimbursement rates are always a huge challenge, whether it's cuts that you might see on the state level or even the federal level is a huge concern. We do have programs in place to deal with our children. SCHIP, of course, is one of the the federal plans to deal with children that don't have health care coverage. Senior care is certainly our state program that deals with pregnant women and also our children and those that are disabled. But getting back to the question of funding, the whole question is, how can we make Oklahoma grow its revenues so that we can have the type of money that we need to be able to match the federal dollars, so we can pull down those federal dollars to the state of Oklahoma, and how can we make government more efficient and effective so that we can put our dollars to where the most need is. And that is why one of my pillars in my platform is to look at state government itself, look at all different functions of government, not just Medicaid, but all different functions of government, and to look at if the mission is still relevant, if it's cost efficient, if it's effective, and to bring the type of technology, the type of systems into government so that it does what it's supposed to do. We don't waste money, because if we waste money, then we don't have money to put towards important priorities such as taking care of our children, taking care of our elderly, and many of our other important state needs that we have, and matching some of that federal dollar. So that is going to be, two main pillars in my administration is generating a better economy, creating a better economy, and also focusing on making government more efficient so that we'll have the revenue that we need to be able to match some of that federal money.
This goes back to one of my answers earlier, I believe, where I said one of the things that we need to do is to come in and let this session be about the budget, because we do have an over $1 billion shortfall of one-time revenue, so we've got a hole we're going to have to figure out where to fill it. And I believe if we can come into session and let all legislators be involved, and they become more educated in how the dollars are being spent, and it gives us an opportunity to look at the budget without the framework of the ordinary legislative session. So it is the priority. It is where we have a chance to see if programs are similar and we can combine them so that we have dollars that we can set aside for these areas where we have federal matching. It is almost cutting off our nose to spite our face when the state of Oklahoma does not fund a program where we can get a 3-to-1 or something match of federal dollars, because we know every dollar that's related to health in this state is a necessary $3 or $4 that we could have to help address the concerns that many of you have asked in these questions already, and to make sure in the future that Oklahoma has an opportunity to make smart budget decisions. I really hope that I can get the legislature to send to a vote of the people a state question that would allow us to do a 2-year budget cycle, and every other year focus solely on the budget, so that we don't get caught up in trying to leverage special interest legislation against the important needs of the state called the budget. When we do that, we begin to identify the dollars that we need to spend. Legislators become more aware of what we're either spending or not spending on programs that could have an exponential benefit to the state of Oklahoma. So we can't say that we're going to have all this money right up front, but if we spend our money wisely, if we look for where there are duplications or similarities in our budget, then we have an opportunity to say, let's put it where we multiply and maximize our dollars.